Hi there, it's New Zealand naturopath Eric Backer. I'm the author of a book called Candida Crusher, and I'm the formulator of a range of products called Candida. Thanks for checking out this video today. I got a question here from a lady called Jill Wentz from San Bernardino. San Bernardino, it sounds like somewhere in Italy, but I think it's in California somewhere. A lot of sand places like San Jose in California. So Jill's asking me the question, Eric, are sinus infections related to yeast? This is a great question, Jill, and something I can certainly talk to you about. There's definitely a link between sinus infections, particularly chronic sinus infections, and candida and yeast. Acute sinus infections are often, more than often, bacterial, but the chronic ones often have a relationship with what we call AFS, or allergic fungal sinusitis. So let's talk a little bit about sinus in general. So sinus is a condition that a huge amount of patients have contacted me for over the years. I think the Mayo Clinic did some research with a group of about 210 patients, and they found that 96% of these people, they could culture 3 or more strains of yeast from the mucus of 96% of 210 people. That's a lot of people and a lot of different kinds of fungal strains. So there's definitely a relationship there with the fungus and chronic sinusitis. And of course, if you go to WebMD or a website like that, the first kind of treatment they're going to recommend is antibiotics, which is pretty dumb because antibiotics will make you more susceptible to getting candida. And many of my patients with chronic sinusitis, in fact, have had 1 or more rounds of antibiotics. So that's a pretty dumb thing, to do, is actually take an antibiotic for sinusitis. So if you've got chronic sinusitis, don't take an antibiotic, because you'll just make sure that it stays longer and the yeast strains become more virulent. So there are different ways you can treat yourself with sinus infections, but probably one of the most important things you can do is to look at a candida cleansing approach, like the Candida Crusher diet, the 3-stage diet. That's going to help you significantly. And also look at different kinds of products that are going to help you, a good antifungal, a good probiotic enzyme. So check out my my website, candida.com. That will give you some idea on the kind of things that I make. But you can really help yourself a lot overcoming chronic sinusitis by strengthening up your immune system and by using essential oils, by changing your diet. There are many different things that you can do. Check out yeastinfection.org. There's some good information on there as well about sinus and yeast infection. But treating yourself locally is important. The best way to overcome a chronic sinus infection is to do it holistically, looking at diet and lifestyle and some supplements, and using some essential oils. Other suggestions I give patients often are using a neti pot, or using a situation, it could be a plastic bottle you can get from the chemist with a little silicone tip to squirt water up the nose, to suck it in and spit it out the back of the throat. You can get little Ayurvedic pots that will do that with saline rinses. They will help to a degree too. When you have got chronic sinusitis, you need to make significant diet changes. We certainly take out all the allergy-forming foods from someone's diet, particularly cow's milk and dairy products, alcohol, chocolate, peanuts, oranges, bananas. Those are some of the key foods we remove. And we make sure that the house is well ventilated and that the patient's living in a mold-free environment. Many people have got mold in their environment, and that can create a big problem for a recurring allergic fungal sinusitis. The other tip I'll give you with chronic sinusitis or recurring is to get your teeth checked out in case you've got root canals or problems on the upper, the upper teeth that can affect the maxillary sinus and cause a recurring chronic sinus, which I myself suffered from for 7 years until I had a root canal tooth removed and the sinus disappeared within 14 days. So that could be another one of the causes of chronic sinusitis. Don't forget, keep away from antibiotics because they will almost guarantee, if you've had sinus, that you'll get it recurringly. Thanks for tuning in, and thanks for your question, Jill.